Okay, in this lecture we're going to cover radiation physics in your radiation protection course. So here we are doing health physics today. Your objectives: define health physics, list the cardinal principles of ALARA, explain the meaning of NCRP and the concepts of dose limits, name the recommended dose limits for radiation workers in the public, discuss the radiosensitivity of stages of pregnancy, describe the recommended management procedures for pregnant radiation workers and for the patient. So let's take a look. Health physics. Okay, what is it? It's concerned with the research, the teaching, the operational aspects of radiation control. There are three cardinal principles. So we have minimize the time of radiation exposure, maximize the distance from the radiation exposure, and use shielding to reduce that radiation exposure. So it provides occupational and radiation protection and minimizes radiation to the public. And we do that through this concept that's called ALARA, which is as low as reasonably achievable. So we know that our diagnostic radiology has a linear, non-threshold dose-response relationship to radiation exposure, right? So if we take a look here at stochastic, we have our stochastic graph here, and you can see below this red line is considered spontaneous genetic defects, right? So, or cancer, or leukemia, whatever it is, okay? So that's spontaneous, where the body just goes awry and it does it just randomly. Then we have this non-threshold linear dose response to that radiation, okay? So stochastic effects are random and unpredictable. And at low doses of radiation, like we have in diagnostic radiology, it's not likely that we'll have stochastic effects like cancer, but it could happen, okay? So at doses, as the doses increase though, the probability of occurrence does also increase. So we have our three cardinal principles. We have time, distance, and shielding. We're going to go through each one. First one, minimize time. First of all, what's exposure, right? Exposure is the exposure rate times the exposure time. That is your exposure to the radiation. So some people want to call it total exposure, whatever. So it's your exposure. So that's exposure rate times exposure time, or how long you've been exposed, okay? So keep exposure times as short as possible. Patient dose directly related to the duration of radiation exposure. So keep exposures to a minimum, especially when you're working with pediatrics. So you want to keep it as low as possible. So think of it as reducing the dose to the patient. If you're in the room on a fluoro exam, it's going to reduce the dose to you. And we want to keep the time as short as possible to reduce motion, okay, for that patient. Then we're looking at distance. We want to maximize the distance. When we do that, we increase the distance between the patient and the X-ray tube. The beam intensity goes down. The patient dose also goes down, but the receptor exposure does decrease, right? This decrease in exposure is calculated using what? The inverse square law. We've talked about that a million times. We talk about intensity and we talk about distance. Remember how we talk about how distance is always squared, right? It's very sensitive when we're talking about radiation dose and exposure. If we take a look at it and we say, okay, let's decrease the distance. What's going to happen here if we decrease the distance? Our intensity is going to go up, right? So our SID, instead of 72, we're at 40. So the intensity is going to go up. The patient dose, it's going to go up too, and the receptor exposure is going to go up. This is if you make no other changes, okay? So this increase in exposure is calculated using the inverse square law. So here it is. This is our inverse square law. So you have your intensity of 1 over intensity 2 is equal to the distance of 2 squared. Remember, it's called the inverse square law. So these two are flipped. So here we go, and they're always squared because it's distance. So it's I1 over I2 is equal to D2 over D1 squared, okay? All right, shielding, let's talk about that. You always want to position the lead shield between the radiation source and exposed person, okay? So here you can see our primary beam is going to come out of the X-ray tube, and you want to put the shield here. Remember, we talked about off-focus radiation, the radiation that's created off the focal tract. So that is going to expose her below the collimated field. Okay, so that's what that is. So we always want to put the shield between the patient and the X-ray tube in the primary beam. So protective aprons should reduce the occupational exposure to us by 25% if we're wearing lead in the X-ray room, which is a good thing. All right, so this is a dosimeter, and you have to wear them if you're being exposed to radiation. So all of you have one. So occupational effective dose for occupational radiation exposure is based on the occupational radiation monitor. This occupational effective dose is assumed to be 10% of the monitored dose. Dosimeters, it's a device that measures radiation, okay? The annual occupational effective dose limit is 50 millisieverts. So most of the time you guys have some kind of dose on your radiation badge and you freak out. It'll be like 10, but it's 10 microsieverts, okay? So if, let's say you had 50 microsieverts, that would be 0.050 millisieverts. You see what I'm saying? So you guys get all jumpy when you have any kind of reading on your badges, but just know that they're in micro, not milli, okay? So you can have a lot of dose compared to micro to milli, okay? So if we look at the NCRP, we look at the annual dose. The whole body dose is 50 millisieverts. To the lens of the eye, for us occupational workers, it's 150 millisieverts. And your extremities are 500 millisieverts. You are going to have to know this, so learn it now. The public annual dose for continuous exposure is 1 millisieverts. The effective dose equivalent for infrequent exposure is 5 millisieverts, and the lens of the eye, skin and extremities is 50 millisieverts. For the embryo fetus, okay, the total dose equivalent limit for the gestation of the pregnancy is 5 millisieverts, okay, but they can't exceed a dose per month of 0.5 millisieverts. So they get a fetal badge that is worn at the waist level. And every month we measure how much dose they receive. And if they exceed 0.5 millisieverts for that month, they are not allowed to work any longer with radiation. Okay? And their whole gestation is 5 millisieverts. All right, so education and training. Exposures, so this doesn't apply to us as rad techs, which is very odd, but you guys still don't reach these dose limits anyway. So it's 1 millisieverts, and for the lens, skin, and extremities, it's 50. So you fall under our 50 millisieverts here. So you need to know all of these numbers. These will all be on your boards. All right, let's talk about some terrorism. It's a little scary when you actually learn about it. So there are terrorists that have dirty bombs. They have nuclear radioactive material. There's biological and psychological impacts with that. So let's take a look at the different ways that they could be messing with us, right? So here, radiologic terrorism is the introduction. We attend to rescue and medical emergencies before radiologic concerns, okay? So if we know that there's a bomb coming, we are going to act prior, okay, trying to protect people. First responders make first decisions in early stages of radiologic terrorist event. The first responders may be X-ray techs, which is kind of cool, right? Tasks of emergency responders, the goal is to prevent injury and death, attend to medical needs of the victims, but they also, if it's any kind of radioactive anything, they have to practice ALARA. So they need to limit the acute high intensity of exposure and limit low intensity exposures also. So long-term effects there. Let's talk about the different ones, okay? So we have the different radiologic devices is a radiation exposure device. We call it a RED. We have a radiologic dispersal device, an RDD. So there's an RED, an RDD, and a improvised nuclear device, an IND. Okay, so if we look at this RED, it's a dirty bomb. Sealed, it can be a sealed radioactive source placed in a public place that causes exposure, but not contamination to those in its proximity. So if we look over here, they say an RED, it's a radiological exposure device, a device whose purpose is to expose people to radiation rather than disperse radioactive material. So it's considered a silent source. And one very interesting thing that you guys probably are not aware of is that there is radiation detection all over our cities. So we used to have patients who would get a PET scan and they are emitting radiation. So they would go to the mall across the street and we'd tell them, do not go to the mall, go straight home. So they would apprehend them because they set off their radiation detectors. So they'd apprehend these patients of ours at the time, and they would call us to see if they had a procedure. So there's radiation monitoring devices placed all over. I didn't know if you guys knew that or not. So it's kind of something cool. Government taking care of us. All right, so let's talk about an RDD. It can be a bomb or a non-explosive device which disperses radioactive contamination over a wide area. Ooh, that's not good, right? It can be powder and mist. It's spread over large areas though, okay? Usually it's troublesome but may not be life-threatening, okay? So here consists of two main ingredients: high explosives, nuclear material, might possibly be shielded to minimize detection. So it could be in a lead container and then a powder could be spread out over a large area, okay? Here we go, an improvised nuclear device. Yikes. An IND contains nuclear material that can produce a nuclear explosion. An IND is a nuclear weapon. So this is not a good thing. So explosive device designed to cause a nuclear event may result in a partial yield, physical and human damage dependent on the blast and the thermal yield from the bomb. All right, so with that, let's go into radiation protection and guidance, right? We must protect against exposure to external radiation, particle and photon radiation, and internal radioactive contamination. It's accomplished by establishing boundaries using radiation monitoring instruments. So the inner boundary is established at an exposure rate of 100 milligrays per hour. Okay, so that inner boundary is 100 milligrays per hour. Inside this boundary, assumed radioactive contamination is high. All right, so radiation detection equipment. So what do we use to detect in real time, right? Our badges we have to mail off. So there's different monitors in which we use. So radiation detection equipment should be readily available to first responders. So on the fire trucks, they have these radiation monitors. So should be capable of measuring radiation exposure levels to 500 milligrays per hour. And radiation detection equipment, which is the picture that you have here, is designed for radiologic terrorism. That doesn't sound fun. All right, so emergency responders, protective equipment. So they have standard protective coveralls. They have shoe covers to protect against radioactive contamination and protective respiratory devices for aerosol contamination. Decontamination of these victims may be necessary. Areas should be coned off and contaminated to clean step-off pads should be provided. So they have these pads that the patients get undressed and cleaned and decontaminated. Then they have to step onto a clean pad. Okay. So last slide. Can you believe it? Easy chapter. So you need to know what health physics is. You need to understand and be able to tell me what the ALARA policy is. and that includes minimizing time, maximizing distance, using shielding, and the equation that we use for it, which is the inverse square law. There's also radiologic terrorism. So we have these radiation exposure devices, we have radiologic dispersal devices, and improvised nuclear devices, which is a nuclear bomb. So that is your first lecture. This one is on your physics.